A seizure is an abnormal discharge in the brain. Typically in adults, that discharge starts in one part of the brain and often rapidly spreads. And it can remain in one part of the brain, in which case we call it a focal or a partial seizure, so that one arm might shake or one leg might shake, or the patient might lose speech or something along those lines. If it spreads, then it can become a convulsion with tongue biting and incontinence. And afterwards, patients are often confused. In an adult, it often means that there's something irritating the cerebral cortex or the outer portion of the brain. And that something could be a stroke, it could be a brain tumor. If it's somebody who has a fever, it could be meningitis. It could be withdrawal from alcohol. It could be some other medication. At some point he will or has already had an MRI of the brain. And that's the most sensitive test for picking up a small stroke, picking up a brain tumor of some sort. He's probably getting that test done with IV contrast. So they're putting he has an IV in his arm and they're running that contrast in his arm to make that MRI more sensitive.